Tracy Morse. I'm the project manager of the Scotland Chikwawa Health Initiative, which is a civil engineering programme which takes place in the southern region of Malawi. It's a holistic health programme where we work with communities to improve their disease control, water and sanitation and reproductive health issues. Currently the project is funded primarily through the Scottish Government International Development Fund. We work with communities, we train communities, we spend time with them discussing their health issues so that we can look for local solutions for local problems. The majority of communities have very poor access to drinking water, safe drinking water. They access water through boreholes, where women may need to walk for up to an hour or 2 hours a day to collect water and then wait for up to an hour to get water from the source. Water may be clean when it comes out of the borehole itself, but by the time it then goes back to the household and is stored, it's contaminated with organisms that can cause diarrheal disease. Diarrhea is in the top 3 leading causes of death in children under the age of 5, and 1 in 5 children in Malawi never reach the age of 5 in the first place. The area that we now concentrate in Chikwawa, some of the health centres are up to 30 kilometres away, and women have to walk to that health centre, for example, when they're in labour. So we're trying to work with communities there on how they can access that health facilities. There are no buses. People use bicycles as taxis. They sit on the back of a bike and they're cycled along. And if you're a woman in labour, that's not particularly comfortable. So we're looking at interventions we can use, for example, in our maternal health programme, where they have shelters that they can stay at the health centre in the weeks coming up to their delivery, so that they're already on site to deliver with a skilled attendant and not delivering babies at the side of the road, which is often the case. So we look at working with communities to improve their health access, to make sure that they have access to very simple treatments and solutions, but most importantly for us, because we're environmental health officers, is to look at prevention rather than cure. So we want to look at how we work with communities with good sanitation, good water, to prevent people getting sick in the first place.